everyone, and welcome back to Crime Beat Conversations. I'm your host, Rafaela Lipschitz, and today I'm so excited to be joined by Dr. Karam Shaar. Dr. Shaar is a non-resident fellow here at the New Lines Institute looking at the captagon and methamphetamine trades in the Middle East. And today we're going to be talking a bit about the methamphetamine landscape in the region, how the fall of the Assad regime has impacted this landscape, and what we should be looking for. Thanks so much, Karam, for joining me today.
Thank you.
So, Karam, my first question is, with the fall of the Assad regime and the subsequent disruption of state-sponsored captagon production, should we expect to see a surge of methamphetamine production and consumption in the region?
The short answer is no, because what we know from the data that we've been collecting is that the Assad regime has been far more involved in the production of captagon as opposed to methamphetamine, even though chemically they can be quite close and the production method shares a lot of similarities between the two, but actually the regime was far more focused on captagon. Methamphetamine tends to be far more concentrated in the Gulf zone when it comes to consumption, and in our region, Iran, Afghanistan, and Pakistan in terms of supply.
For captagon producers that weren't necessarily associated with the regime, do you expect them to switch to methamphetamine production, and how difficult would it be to make that switch?
It's an excellent question. And the main reason why we started working on the methamphetamine project at the New Lines Institute was the fact that we were hearing a lot about methamphetamine, but didn't really know what does that actually mean. So that prompted us a year ago to start collecting all the data. Now the database is completed and we can answer some of these questions. So we've been seeing actually a decline in captagon seizures coinciding with an increase in methamphetamine seizures. And this trend has also been going like maybe from 2021 to 2022, you see that increase. So if you look at the count of meth seizures, for example, over the past 10 months versus the year before, they're somehow on the same level. If you compare them to maybe 4 years prior, they might be 5 times higher. So there's that significant increase, but also starting to plateau. That's not what we were seeing with captagon. The opposite was actually starting to happen there. It was on the decline, in part, and we made that argument before in one of our reports, in part because the Assad regime was starting to engage with Gulf states. So it was indeed cracking down on some of the production internally. Now, for captagon producers to switch to methamphetamine, the switch shouldn't be very difficult. The question is whether there is enough market for it or not. There are many factors at play here. Captagon pill prices have increased significantly following the downfall of the Assad regime, where the production crashed. You know, Assad was trying to curb it a little bit while he's politicking with Gulf states, but it crashed after Assad's downfall. That has resulted in a rise in prices for captagon. And for most drug addicts, methamphetamine is just another stimulant, you know. It's the ugly cousin. It has far worse health impacts, but many people would be actually willing to make that switch because if meth is cheaper. And that's what we're really looking at the moment, you know, how the two trades actually relate to one another.
Thank you. And if that does end up being the case, if meth is cheaper and therefore used more widely in the region, do you think that will coincide with an increase in violence for smugglers and kinetic clashes between smugglers and law enforcement?
In general, it's fair to say that smuggling activities and violence tend to have a very strong correlation. However, it's only a correlation, and at times it can be quite weak, as we are seeing at the moment. So in 2025, the sharp increase in the amount of methamphetamine seized has not been accompanied by a rise in violence. The reason being, these networks in their illicit activities keep adapting. So they change their methods. Who knows? Maybe now they're relying on drones far more than they were before. And that's the issue with the data that we're collecting. So you can only see what the seizures tell you, but there's that large part that we just have no information about. So I would say it's more likely than not that if methamphetamine continues to grow, there will be an increase in violence, but that's not necessarily always the case.
And how are governments in the region responding to this? Are they prepared for this potential threat, this change in the sort of drug landscape and shift from captagon to meth?
Unfortunately, and I feel like this applies to the world at large, we're generally not prepared for the threat of narcotics. In the region, it's worse because there is way too much focus on supply as opposed to demand. A problem that the US also has. There's just so much focus on, we're going to defeat them, we will crush them, we will not allow them to enter, and so on. But very little is actually done about convincing Americans or people in the Middle East, well, how about you do not use that drug? Teaching them at schools, about this, improving health facilities. If you want to quit, we help you quit. Unfortunately, in the Middle East, this is very much an issue. On the supply side, you see increased coordination, which is always a great sign because it's an international problem. And this has resulted in improved capacity to interdict, especially after the downfall of the Assad regime. The Syrian government has been sharing intelligence with the Iraqis quite successfully, with the Jordanians, to a lesser extent also Lebanon and Saudi Arabia. But the issue with that coordination is it's not being done systemically. So every 6-7 months you hear, oh, Iraq is calling for a regional mechanism for cooperation. They go meet and there's no follow-up. There's no institution that is born out of that agreement. You see the same in Jordan. Jordan and Syria go and sign an agreement about cooperation in that space, but not really with Iraq. Or they go and work with Interpol on countering narcotics, but not really regionally, and so on. So it's extremely fragmented. It's not being done systemically. And that is the key issue. Intelligence sharing is very important for interdicting captagon or meth supplies. But unless it's done in a systemic fashion, it's not going to be sustainable.
And finally, Karam, we've been talking about this in the context of the new lines, methamphetamines in the Middle East project. Can you talk a little bit about what that project is going to be looking at, what sorts of things you're interested in seeing, and the types of analysis that you'll be producing?
So basically, the same idea that we had for the Captagon project is now being replicated for methamphetamine. What I mean by this is the core of the problem has been there is no data. So no one really is reporting accurate data on counter narcotics operations in the region. Some countries report to UNODC, some don't. Some report in 1 year, but maybe not the other. Some report figures, but they're reported by one arm of government. So maybe it's just the border guards, but not really the Ministry of Interior, who's in charge of domestic seizures and so on. So what we have been doing over the past, I think, 3 years now is let's actually collect this data from open sources. And quite often we've been getting numbers that are far higher than official numbers. And with Captagon, as I was saying earlier, we were starting to realize the limits of our knowledge, about central nervous system stimulants because of ignoring methamphetamine. Now we decided to actually go and cover it all. So we have now over 1,200 lines. These can include seizures, can include lab busts, they can include arrests, and so on. And we will use this data the same way we were using it for the Captagon project. So we will produce reports, maybe podcasts, an interactive tool to track the data. So for that last part, the interactive tool for methamphetamine is now done. We will publish it soon. And you can use it to filter through countries, the way the shipment has been sent, maritime shipment or land or an aerial shipment, the number of people arrested, where it was coming from, the country of consignment. You will have a time slider, so you also play around with these incidents and see how they're changing over time. It's a great analytical tool, really, for people who are trying to analyze the industry. For those who are just interested in our own analysis, they can just read the reports or watch such short recordings.
Well, Karam, thank you so much for joining me today and for talking to me about this important issue. And thank you, everyone, for tuning in to this episode of Crime Beat Conversations. Please be sure to stay tuned for more from the New Lines Institute's Methamphetamines in the Middle East project, as well as the Captagon project. And thank you. See you soon.